name's James Elder, if you look me up online, but I go by my middle name, Brad. I'm at The Ohio State University in the Department of Neurological Surgery. I've been here practicing neurosurgery for 14 years. My interests have long been in the ability to deliver therapeutic agents to the brain in a targeted fashion. And of course, specifically, my interests recently have entered the realm of neurodegenerative disorders and specifically frontotemporal lobar degeneration or frontotemporal dementia. Frontotemporal dementia is a brain disease that affects adults. The average age of onset is between ages 50 and 60, and it's one of the most common forms of dementia below the age of 65. Symptoms with frontotemporal dementia include, of course, the dementia that's in the name, but that's characterized by behavioral changes, emotional changes, impairments in language, so the ability to speak and get your thoughts out. And then there's different variants of frontotemporal dementia that can include various motor symptoms too. But essentially, it's a progressive and relentless decline. And so once the disease is diagnosed and once it takes hold, there's a progressive decline in neurologic function, ultimately culminating in death. Currently, there's no disease-modifying treatments for frontotemporal dementia. The disease is managed by essentially managing symptoms, by managing the sequelae of the disease. So supportive networks that can be provided to patients are optimized, and family support, because families bear a significant portion of the burden of the disease. So it's primarily supportive at this point in time. AVB-101 is a gene therapy. It's an investigational therapy, so it's difficult to comment on how it has worked. But the treatment is designed to restore levels of progranulin in a specific subset of patients with frontotemporal dementia that have a GRN mutation. So a GRN gene mutation leads to reduced levels of progranulin. And this gene therapy is designed to replace that lost function, the lost genetic function. So currently, patients are being enrolled in Europe and in the US, only at our center, The Ohio State University. The first phase of this trial is intended to enroll a small number of patients. I believe the number is around 10 or 12. And it marks the first in human intrathalamic gene therapy trial for adult neurodegenerative disease. So gene therapy can be administered a number of ways. In this study, we're administering the gene therapy directly to the target nucleus in the brain, which is the thalamus. So it's delivered using an injection of the gene therapy agent, and it's directly targeted to the thalamus. Not only that, we are monitoring where the injection goes within the thalamus using MRIs that are done during the surgery. So we know exactly where we deliver the gene therapy and can confirm the accuracy of targeting the structure that we're intending to deliver. Once the gene therapy is in the thalamus, the genetic material that's delivered begins to do its job. And its job is to make progranulin in replacement of the lost function from the mutation that prevents patients from making an adequate amount of progranulin. So the enrollment in the US should be imminent. We should hopefully be enrolling and treating our first patient in the next couple months. Enrollment has already begun in Europe, where 2 patients have been treated. The time course for getting results clinically is tough to answer because this is a first in human trial. It's very difficult to predict how patients will respond to the treatment, and therefore it's difficult to predict when they would respond, if they will. And so I'm going to have to leave that question, I guess, a little bit unanswered in terms of being able to report data. In my view, progranulin mutated FTD is a disease that we are excited to begin a new first-in-human gene therapy treatment. But this disease and other diseases like it are in desperate need of ongoing research. Research like we're performing that's supported with preclinical data, but also continued research to try to get to the root of how we can help patients and what we can do to better their lives going forward.